Welcome back to part 2. Let's dive right in. Medication number 4. Statins, a double-edged sword for your brain and heart. Statins are among the most prescribed medications in the world, used to lower cholesterol and reduce the risk of cardiovascular disease. But recent studies have raised concerns about their long-term effects on cognitive health, especially in older adults. Statins work by inhibiting HMG-CoA reductase, an enzyme the liver uses to produce cholesterol. While this helps reduce LDL levels, the so-called bad cholesterol, it also affects the production of other vital molecules like coenzyme Q10 and prenylated proteins, both of which play crucial roles in cell energy and brain function. Cholesterol is also a key component of neuronal membranes and myelin sheaths. Disrupting its balance can affect synaptic plasticity, neuroinflammation, and the transport of neurotransmitters like serotonin and dopamine. A major 2025 systematic review and meta-analysis by Westphal-Filho and colleagues published in Alzheimer's and Dementia. Translational research and clinical interventions re-evaluated the link between statins and dementia risk. Their findings? No definitive protective effect of statins on all-cause dementia or Alzheimer's disease. In some subgroups, particularly those using lipophilic statins like simvastatin, there was even a suggestion of increased risk. These lipophilic statins cross the blood-brain barrier more easily, potentially disrupting cholesterol homeostasis in the brain. Backing this up, a 2023 umbrella review published in the European Heart Journal, Cardiovascular Pharmacotherapy, examined dozens of studies and echoed these concerns. It concluded that while statins do have undeniable cardiovascular benefits, their effects on cognition are nuanced and may vary based on type, dosage, and individual risk factors such as age, APOE genotype, and existing neurodegenerative disease. So, should you stop taking statins? Not without a thorough conversation with your doctor. These medications save lives, but like all powerful tools, they require careful use. For patients at low to moderate cardiovascular risk or with a family history of dementia, especially those over 65, periodic cognitive monitoring may be wise. If you experience memory issues or confusion after starting statins, don't ignore them. Report these symptoms and consider a medication review. In some cases, switching from a lipophilic to a hydrophilic statin like pravastatin may be an option with fewer CNS effects. Medication number 3, benzodiazepines, a chemical lullaby with a hidden cost to your brain, balance, and independence. Benzodiazepines, such as alprazolam, lorazepam, diazepam, and clonazepam, are commonly prescribed to treat anxiety, insomnia, seizures, and panic disorders. But beneath their calming effect lies a hidden cost, especially for older adults. These drugs work by enhancing the activity of gamma-aminobutyric acid, or GABA, the brain's main inhibitory neurotransmitter. This increased GABA activity slows down brain signals, producing sedative and anti-anxiety effects. However, this also affects areas like the hippocampus, the part of the brain responsible for forming and retrieving memories. With repeated or prolonged use, benzodiazepines dampen hippocampal function, impairing long-term memory and accelerating cognitive decline. As we age, our bodies become less efficient at metabolizing these drugs. Due to changes in liver function, kidney filtration, and body composition, with more fat and less muscle mass, benzodiazepines stay in the system longer and accumulate more easily. That's why older adults are especially vulnerable to side effects like confusion, dizziness, impaired balance, and falls, which can lead to fractures, hospitalizations, or even death. In 2020, recognizing these severe risks, the U.S. Food and Drug Administration issued an updated black box warning. It highlights not only the dangers of combining benzodiazepines with opioids, but also the serious risks of misuse, addiction, physical dependence, and life-threatening withdrawal symptoms. Cognitive effects are not just theoretical. A 2021 review by Hirschtritt, Olfsson, and Kroenke, published in JAMA, emphasized that benzodiazepines can impair attention and short-term memory, particularly in older adults, and increase the risk of dementia, especially when used long-term. Another 2023 study in Neurology International further confirmed that chronic benzodiazepine exposure is associated with an elevated risk of Alzheimer's disease, independent of other health conditions. So how can we use these medications safely? First, they should only be prescribed for short-term or acute use. For anxiety or insomnia, lifestyle strategies like sleep hygiene, mindfulness, therapy, and regular physical activity are more effective and sustainable. If benzodiazepines are necessary, they should be used at the lowest possible dose and for the shortest duration. Avoid sudden discontinuation. Tapering off the drug under medical supervision is crucial to prevent withdrawal symptoms such as tremors, agitation, or seizures. If you or a loved one has been using benzodiazepines for a long time, don't panic, but do talk to your doctor. A gradual, supported reduction may help protect your brain and restore your balance, both physically and cognitively. Medication number 2, Amitriptyline, a deceptively gentle pill with lasting shadows. Amitriptyline, a tricyclic antidepressant first introduced in the 1960s, is still widely prescribed today to manage depression, anxiety, chronic pain, migraines, and even insomnia. Amitriptyline helps regulate mood and pain by increasing the levels of two essential brain chemicals, noradrenaline and serotonin. These chemicals, known as neurotransmitters, act like messengers between brain cells. When their levels are too low, a person may experience depression, anxiety, or heightened sensitivity to pain. Amitriptyline works by blocking the transporters that normally remove these neurotransmitters from the spaces between nerve cells, allowing more of them to stay active and continue transmitting signals. Noradrenaline is especially involved in alertness and physical energy, while serotonin plays a central role in mood stability, sleep quality, and emotional regulation. However, the effects of amitriptyline go beyond this. It also blocks many different types of receptors in the brain. These are like tiny locks that respond to specific chemical keys. By blocking several serotonin receptor subtypes, such as 5-HT2A, 5-HT2C, and others, amitriptyline alters how serotonin signals are processed, which can improve mood but may also cause dizziness or digestive upset. It interferes with alpha-1 adrenergic receptors, which normally help control blood pressure, and this can lead to dizziness or lightheadedness when standing. Blocking histamine. H1 receptors causes drowsiness, which is useful for insomnia but may lead to daytime grogginess and slower thinking. Most importantly, amitriptyline has strong anticholinergic effects by blocking muscarinic acetylcholine receptors. These receptors are crucial for memory, attention, and clear thinking. When blocked, especially in older adults, the result can be confusion, memory issues, and an increased risk of dementia over time. Lastly, it also interacts with sigma-1 receptors, which may influence pain and emotional balance, though their role is still not fully understood. Beyond the pharmacology, a 2021 case report by Umaharan et al. Detailed the development of amitriptyline dependence in a patient self-medicating for chronic pain. The individual experienced withdrawal symptoms, compulsive use, and dose escalation, criteria consistent with substance use disorder. Though not commonly classified as addictive, this example highlights the potential for misuse in vulnerable individuals, especially when mood-elevating or sedative effects become reinforcing. In addition to cognitive and dependency concerns, long-term amitriptyline use has been associated with an increased risk of falls, cardiovascular complications like QT prolongation, and exacerbation of other conditions such as glaucoma and urinary retention due to its broad receptor activity. Proper use of amitriptyline starts with understanding its risks. It should be prescribed at the lowest effective dose with slow titration to minimize side effects. In older adults, doses above 50 milligrams per day are generally discouraged. Because of its long half-life and sedative properties, it is typically taken at night. Regular follow-ups are essential to assess side effects, cognitive function, and emerging signs of dependency or inappropriate use. It should never be stopped abruptly. Tapering is necessary to avoid withdrawal symptoms like nausea, anxiety, irritability, and flu-like effects. Importantly, patients and caregivers must be educated about its anticholinergic burden and monitor for changes in cognition, especially in older adults. Though amitriptyline remains a powerful therapeutic tool, it carries quiet risks that, when overlooked, can gradually impair memory, attention, and emotional health. Its utility demands respect, not only for what it can treat, but also for what it can quietly erode. Medication number 1. Anticholinergics, the hidden burden behind fading memory. Using multiple anticholinergic medications at the same time may silently chip away at one's cognitive health. These drugs, commonly prescribed for conditions like depression, urinary incontinence, and Parkinson's disease, work by blocking acetylcholine, a neurotransmitter that plays a vital role in memory, attention, and learning. When multiple anticholinergic medications are taken together, their effects don't just add up, they compound, leading to a significantly higher anticholinergic burden. A landmark 2021 meta-analysis by Jung and colleagues, encompassing data from over 1.5 million individuals, found that the use of anticholinergic medications was associated with a 1.20-fold increased risk of all-cause dementia, including Alzheimer's disease. More importantly, this risk was dose-dependent. The higher the cumulative exposure to anticholinergic medications, the higher the likelihood of developing dementia. Certain drug categories, particularly those used for urinary issues, depression, and Parkinson's disease, were linked to significantly elevated risk, while others like cardiovascular or gastrointestinal medications showed no such association. This suggests not all anticholinergics are equally harmful, but the cumulative burden from multiple sources remains dangerous. In 2023, Gildingers and colleagues expanded this understanding by showing that even the use of a single anticholinergic medication was associated with an increased risk of developing mild cognitive impairment, MCI, an early but potentially reversible stage of cognitive decline. Interestingly, they did not find a clear link to full-blown dementia, suggesting that early intervention, such as reducing unnecessary anticholinergic use, might prevent further progression. A recent 2023 BMJ review emphasized that minimizing modifiable risk factors, like medication use, is currently one of the few effective strategies to delay or reduce dementia incidence. With up to 1/3 of dementia cases potentially preventable, reviewing a patient's medication list for cumulative anticholinergic load should be a routine part of dementia prevention. What you should do? If you or a loved one is taking multiple medications, ask a healthcare provider to review them for anticholinergic effects. Tools like the Anticholinergic Cognitive Burden, ACB scale, or anticholinergic risk. Scale ARS can help assess total drug burden. Even if each drug is low risk on its own, their combined effects may still significantly impact brain health. Reducing or replacing these drugs with safer alternatives where appropriate, could help preserve memory and cognition. Thank you for joining me on this important journey to protect brain health and make informed choices about medication. I hope this information empowers you to have thoughtful conversations with your healthcare providers and loved ones. If you found this guide helpful, please consider liking and subscribing for more evidence-based, easy-to-understand health content. Together, we can raise awareness and make smarter decisions for ourselves and our families. Wishing you and your loved ones a healthy, mindful, and joyful life ahead. Stay curious, stay informed, and as always, thank you for being here.